Hey everyone, and welcome to another episode of The Family Couch. I am so excited to have with us on as our guest today, Maria Davis-Pierre. And she's going to be talking about a topic that doesn't get as much notoriety, I think, in this field, and that is the topic of autism in Black children and in Black families. So I'm excited to dive into this topic today and have Maria share her expertise and her knowledge on how to support families who are living with children who live with this diagnosis. So Maria, thank you so much for being on with us today.
Thank you for having me. I'm excited to be here.
Yeah. So Maria, before we get started, can you give the audience a bit more background about who you are and what you do?
Sure. I'm a licensed mental health counselor in the state of Florida. I own two private practices, one which focuses on parents who have a child on the spectrum, Autism in Black Incorporated. I started this business because I myself have a child on the spectrum. Me and my husband have talked about this, a lot about getting our child diagnosed and how, the journey didn't stop with the diagnosis. There was so much more after that. A lot of people think once you get that diagnosis, then you're on easy street, but there's a lot that comes after that. And what we noticed is that the professionals who would come in and be working with our daughter would not take our culture into consideration. I'm Black, my husband is Haitian. So there are specific cultural things about having, even though I am a therapist, about having somebody come in your home and be doing therapy, So when I continued to see that with the various professionals, I was like, okay, you know what, something has got to change, So I started Autism in Black Inc. to help parents and support parents, Black parents who have a child on the spectrum, to give them, the much needed platform that we need, because our children are being diagnosed at a later rate than their white counterparts. There's a 1 to 2 year gap, and they're being misdiagnosed with behavioral issues all across the board. Right. When professionals are seeing Black children, autism is not in the forefront of their mind. In the forefront of their mind are behavioral issues, or give them a little more time and things like that. Right. And that, then hinders early intervention.
Yes.
So I want the parents to be educated on the signs of autism, what to do when your child has gotten the diagnosis, the next steps, things like that. Because as a parent, you have to be just as involved, as your child who is getting all the services. You, the parent, need to be getting services as well, so that you're supported and you can help your child in the best way possible.
That makes a lot of sense. And I think it's one of those diagnoses that even when you take culture out of it, it's a very confusing, very time-consuming diagnosis. So when you add the cultural piece, I can only imagine how many more barriers and obstacles you have to manage and deal with.
Yes, exactly. I mean, a lot of the signs and the red flags of autism can mimic behavioral issues. And with being only a minute amount of people who can actually diagnose autism, depending on the state you're in, that makes it even more difficult. Yes. We had to take our child to a child neurologist. There was only one in our area. The wait list is, ridiculous. It was an hour and a half away from our home. And then even after speaking with the neurologist and then getting the testing that they do to rule out other things, we were told because she is 18 months, they wanted to wait until she was 3 to give the diagnosis. But exact words, we do believe she is on the spectrum. Right. We do believe she is autistic, but we want to wait till she's 3. Right. Why would you want to wait until she's 3 if you know now? So it was a lot of back and forth to get that diagnosis.
Mm-hmm. And so, as we're talking about this, can you tell us maybe briefly kind of an overview of what the actual spectrum diagnosis look like? Like how do you delineate that between a behavior issue or maybe another type of developmental delay?
Of course, I tell everybody, so in our case, what we did is I noticed for my child that she was having a delay in her speech.
Mm.
And not only a delay, a regression.
Mm.
So she was saying mama, dad, ball, things like that. And then all of a sudden, she didn't say it anymore.
Mm.
She wasn't speaking. So that was a red flag to me, like, okay, something's going on here. There were some sensory issues that I noticed as well. And I told my husband, I said, okay, I think we should get her tested.
Mm-hmm.
And went to the pediatrician to get the referral, of course, and was told there again, we should give her more time. But I advocated for my child and said, you know what, I would still like to get the test done.
Right.
So then what I was given was a referral. And in our state, Florida, it's called the Early Steps Program. And I'm sure many other states may have a similar program where you take your child in and they are assessed by a multidisciplinary team, which includes a OT,
Mm-hmm.
speech pathologist, a developmental pediatrician, and a child psychologist.
Mm-hmm.
And they will test your child on developmental milestones, things like that. They take a parent questionnaire, and they go based on, where your child is meeting those developmental milestones.
Mm-hmm. Mm-hmm.
So after that test, we were told again that, okay, but remember, this is, my child's 5 now. So this was four years ago.
Mm-hmm.
So at that time, they said, okay, we can't give her the diagnosis. You have to go to the neurologist.
What?
Okay, so it's kind of like a circle kind of thing.
Yeah.
But what I tell parents is that you can easily Google the MChat form and take it yourself. It's free. You go on, you take it. It's like 20 questions about things you're noticing with your child, and it can give you a score based on what you've reported. And they will give you a score saying that if your child may be high risk, low risk, medium risk for
Right.
autism.
Right.
So you can take that paper and give it to your pediatrician, and they can give you a referral to the right people to go. But if you're noticing things like lack of eye contact,
Mm-hmm.
lack of facial expression, delays in speech, delays in speech or regression in speech,
Mm-hmm.
repeated behaviors like my daughter likes to spin in a circle, things
Mm-hmm.
like that. It's called stimming. Then yes, I would definitely, take my child in to be tested. And a lot of times, we can't necessarily know just from those signs if
Right.
it's autism or a behavioral issue, which is why I tell people just get them tested regardless.
Yeah.
Because you'll get your answer.
And I feel like when you listed some of those behavioral issues and you even talked about the journey that you've gone on, I go back to the idea of in the African American culture, how sometimes these diagnoses, because of the type of media attention they get and because of the type of attention they get, they're seen as another culture's issue, that doesn't happen in our culture. And so your child might be exhibiting these behaviors, but you may be seeing them as behavioral issues, or you might even ignore them. Or even you might listen to people saying, oh, they'll grow out of it. Kids grow out of this stuff.
Exactly.
What kind of advice do you have for parents who, again, they're looking, they don't even know they should get their child tested, and they feel like this might be another culture's disease. This is not something that happens in our community.
I tell everybody that autism is not race or gender specific. It's all across the board. Anybody can be autistic, you know. And it's not a bad thing. I think a lot of shame comes with that diagnosis for a lot of people, especially in the Black community, because we don't want individuals to think something is wrong with our child,
Yes.
So there's a lot of shame that goes in that. And what they would rather do is not even address it and ignore it rather than getting the necessary, or I wouldn't even say necessary, to get them in services
Right.
that will help them.
Right.
There's no shame in having a child on on who is autistic.
Right.
I scream it from the rooftops.
Right. Right.
I love my daughter, just like I love my other two children.
Right.
So
Right.
I think that is what is, another issue that's going on in our Black community, the shame that comes along not knowing what autism is.
Yes.
I can tell somebody in our community, oh, my child's autistic, and they're like, well, what's that?
Right.
So I can see that there is a gap, that the information is not getting to our communities like it's getting to the other communities.
Correct.
So there's a gap in that information getting to our communities. Another reason I created Autism in Black Youth.
Right.
So there's that aspect of it. Or, people want to, pity you and things like that. Getting an autism diagnosis is not a death sentence,
Right.
So we have to start looking at it in a different way. We just have to make ourselves aware, accept, understand all of those things.
Mm-hmm. Mm-hmm. And one of the things that's really kind of a staple, I would feel, and you can correct me if I'm wrong, in the African American culture is this idea of communal, like kind of community building and things like that. And so for families who maybe are like, okay, I have noticed this is African American family, and they say, okay, Maria, you're right. Maybe I need to get my child tested. I've done the MChat. I have concerns. What do I do next? Like, how do I get my child some services? Because I think a lot of times in our communities, we are sometimes dismissed in professional circles, or people, like you said, you had to advocate quite a bit for your child.
Yeah.
And so what tips do you have for a family who's like, okay, we have some concerns. We know that our child may be on the spectrum, but we don't know who to go to get our voices heard so we can actually get the services at the school, at the pediatrician level. What do I do?
Again, like advocate. Your doctor may say no, but you are the patient. Your child is the patient.
Yes.
You can say, I need that referral. That is your opinion. That's not my opinion. I want to get more testing done.
Right.
You can go to your, if I had known the name of the program, I wouldn't even have needed to talk to my pediatrician, because I could just call it up.
Right.
So I would say, get on the internet, Google where I can take my child to get tested. Things like talk to the school. A lot of times the school, especially for our community, is the first to start noticing these patterns.
Yes.
So like I tell my parents, do not get defensive when the school is saying, hey, we think something is going on with your child. Take that as an opportunity. If it's not, it's not. If it is, now you know something and you can do something about it.
Right.
So I would say advocate for yourself, for your child. Go to your pediatrician. If your pediatrician isn't listening, take the next step. Find a program that's in your community and that will let you get your child tested. And I know another thing that, may be an issue is the finances that come along with it. And it is expensive. I'm not going to lie. It's very expensive. The testing is very expensive. After getting the diagnosis, it's extremely expensive for all the therapies and such, if you choose, to put your child in therapy. So it is very expensive, but there are grants and scholarships that you can get. Insurance doesn't cover everything, but there may be something that they do cover.
Right.
And like I said, the program in Florida, they cover 1 to 2 therapies.
Okay.
So you could get a developmental specialist and speech, for your child. And then, think about the other things that they may need. There are, schools. My child goes to a school that is dedicated to serving autistic individuals. So now she's in the school and she's getting those services.
Right.
So we're not having to pay for those services.
Right.
So make yourself aware of the services that are out there,
Right. Right.
Don't just listen to the person that's saying, oh, there's nothing.
Mm.
Go and look for yourself, advocate
Right.
for yourself.
Are there any programs that may be nationally funded, or there are places where a parent can maybe start, like a specific website or a specific place where a parent can just kind of start and say, all right, I don't know, you're talking about Florida, I might be in New York, like
Yes.
where can I just kind of start?
I am, there are many, and there are, maybe some controversies with, some of the, sorry, there may be some controversies with some of the agencies and,
Yeah. I know there's a little bit of controversy around Autism Speaks, but they
there
seem to
is.
be the biggest one that has all the information, if you
They
will.
they have a big resource guide.
Mm.
I can't lie, and there is a lot of controversy around Autism Speaks.
Mm-hmm.
So what I tell people is do the research for yourself
Mm-hmm.
and make your decision for yourself.
Right.
you know
Right.
so there is Autism Speaks, and there is a lot of resources that are done by autistic individuals themselves.
Okay.
I'm trying to pull up the names because there are just so many. I want to make sure that I am
Giving the
giving you the
correct one.
correct information. Most definitely. There's the autisticadvocacy.org. I
Mm-hmm.
know that they are run by autistic individuals. There is the National Autism Society
Okay.
as well that you can go on. And let me see what else. So a few more out there. There's one that is dedicated to Black families. It's, I
Okay.
believe, the National, I don't want to say it wrong, National African American Autism Association.
Nice.
I don't know if I'm giving the name. It's something to that. I just discovered that myself like last week. I was like,
Nice.
oh, I never heard of that. And I'm trying to
Nice.
Google it. So,
Nice.
I'll make sure in your show notes that I get the right name if
Yeah,
that's
yeah,
not.
yeah. And one of the things I was thinking too is that when you are a family, an African American family, and you do decide, I mean, not decide, but you realize, okay, this is our diagnosis, this is what we're doing. What can another family, I mean, African American families do when they find themselves being the only African American family at a support group, or the only African American family in their community who is speaking out about it? Because that can be pretty isolating when there's other cultures talking about it, and you're like, do we talk about it? What do you have to say to those parents who are kind of in their own minds, or maybe just in what they're seeing in their community, the only ones who are living with this type of issue in their family?
Um, it is isolating,
Mm-hmm.
uh, as I'm one of the very few Black moms at my child's school,
Mm-hmm.
and the way that I see the other people dealing with it is not the way that I would deal with it, is not the way that our culture would deal with it.
Mm-hmm.
So I had to find my support off of Facebook.
Right, right, right.
If you go on Facebook, there are many groups for parents who have a child on the spectrum, Black parents specifically.
Yes.
And I'm in a lot of them. And, you get that support because, one, it's hard for us to talk about in
Mm.
general because as a culture, what do? We have to keep things in our family. We're
Yes,
not out here
yes,
telling our business to the
yes,
world. We don't do
yes,
that. We're supposed to pray about it and leave it at that.
yes, yes,
So,
exactly.
you know so the fact that we are engaging in these groups makes me so happy. There are many Facebook groups. You could just put Black autism parent in the search bar. You'll
Mm.
get a list of groups. um, Reach out to Autism and Black Inc., my company. I do a lot of support with the parents who are Black. It's just different for us to
Yeah,
deal with, and I
yeah,
want to make sure that people are acknowledging that
yes,
difference,
yes,
because
yes.
what some people like to do is a cookie cutter approach, and that doesn't work for everybody. You got to listen to the family that you're with and go from there.
Mm-hmm.
So I would just encourage them to find your support network. And a lot of times, family members may not understand So,
Yes.
okay, so we have to set boundaries with our family members to let them know that, okay, what I'm going through is already, you know, a lot, a lot. So you here telling me, oh, she doesn't look autistic. Oh, let's pray about it. Oh, just whoop her, things like that, that a lot of parents here is adding stress,
Yes.
so we have to learn to set the boundaries with the individuals in our families, our friends, and change your support network.
Yes.
Because if those people that are close to you aren't uplifting you, set the boundaries with them and find another group of people that will do that for you.
Yes.
So you don't feel isolated, so you don't feel lonely, because it gets hard. Being a parent is hard. Being a Black parent is harder.
Right.
Being a Black parent to a child on the spectrum is even more difficult.
Right.
So don't feel you have to be in this alone.
Right. And I think that that's part of, our culture, is to be strong, is to be resilient, is to show that we can take it all. And I think, as you just mentioned, I think when you're dealing with multiple systemic issues, so you're dealing with being a parent, then you're dealing with being an African-American parent, then you're dealing with the autism spectrum and all the difficulties and obstacles that brings. And so I think this idea of being able to say, I can take it all, we kind of have to reframe that, especially in the African-American mother culture. I think that strong Black mom is something we revere.
Black mom.
And so when you're dealing with things, especially like autism, where you got to have services, you can't do it all by yourself. No mother can be the OT and the speech therapist, and you can't do all of that.
No. You have to also make sure to take care of yourself. If you're not at your best, you can't help the others at your best. You know what I'm saying? So you have to make sure to take that time out for yourself. Parents should be getting parent skills training. They should be in their own therapy as well, to get that support, because it's not all rainbows and sunshine. There are difficult days, just as there are difficult days with your neurotypical children. You know what I'm saying?
Right.
So, there are frustrations. There are frustrations of being a parent, of having your multiple roles, of being a wife, a mother, being the advocate, doing all of that, and then having time for yourself. It's a balancing, juggling act, So reach out. Don't feel you have to be that strong Black woman that society is portraying, It's okay to reach out and get support. Don't feel alone, because once you are feeling isolated, then more difficulties come into play that you're dealing with as a parent: depression, anxiety, things like that. So I just encourage you to get the support system that is going to uplift you, and set boundaries with those who don't.
I'm happy you brought up the word boundaries again. As you were talking, I was thinking about, how does that look? Because I think when you are an African-American family, and I mentioned earlier, we're very communal, we're very much about support and having our family members be a part of our lives and help us and caregive with us. And so how do you set boundaries as a parent while you're going through something that may be your mom, who's probably going to help take care of the kids, or your siblings, who's going to have cousins that your kids are going to play with? How do you help that parent teach the family about autism, or set the boundary when the family just refuses to listen? How do you help parents do that? Or what advice do you have for parents who have to maybe make that type of decision?
Yeah, I have noticed in our culture, and even for myself, it was hard to set those boundaries, because like you say, we are a close-knit community. If my mom says I need to do something, I need to do that, even as a grown woman, you know what I'm saying?
Exactly.
Because we have to have that respect and things like that.
Right.
So there comes into a struggle of sorts of, how do I set this boundary of something that you're doing that is affecting me, but still give you that respect? And what I say is, you can educate them, first. Hey, this is what autism is. My child is autistic. That means we now have to start thinking differently in this house. And this is what we're not going to say that, oh, if my child is having sensory overload and you're thinking it's a tantrum, beat them. No, that's not how we handle it here. This is how we handle it here. Set those boundaries with them. Let them know that, what you're doing is affecting me. It's hurting me. So I would appreciate it if you could respect my boundaries, And if sometimes it does take cutting that communication,
Mm.
you know, and it's a hard thing, especially in our culture, to cut
Yes.
that communication.
Yes.
But
Yes.
sometimes you have to do it for your own mental health.
Right.
So
Right.
if you have to, if they're not respecting those boundaries, if they're not respecting, you know, your child, because that's very important.
Mm.
You know, I don't want anybody to make my child feel less than. I don't want
Right.
anybody to make my child feel like something is wrong with her, because
Right.
nothing is wrong with her.
Right.
You know, so if you do those things, you are now crossing a boundary with me.
Right.
So what I'm going to tell you is that is a boundary of mine. You know, I'm going to express it to you. I'm going to tell you why I don't like that. You know, I'm not just going to immediately cut off communication. I'm going to let you know what you did to me.
Right.
So then you can respect it or not. And if you choose not to, then I have to cut the communication with you.
Right.
And
Right.
it sounds like I'm saying, and it sounds like I'm saying what I'm saying is easy
Yeah.
because I'm just saying it, but it's not, you
Yeah.
know, it's serious and it takes a lot, you know, to do. So, you know, that's just what I had to learn for myself. And that's just what I tell the parents that I work with, you know,
Right.
and, you know, work with your therapist on how to set those boundaries.
Yes. Yes.
You know, talk with your therapist about what that looks like for you.
Right.
You know,
Right.
what does my boundaries look like for me? What is enough for me?
Right.
What is a line they can't cross for me? Because my boundaries and your boundaries may be different.
Right. And you know, one of the things that I was thinking about as you were talking is, even if I would say maybe you can get your mom and maybe your close siblings to understand, I can imagine children on the spectrum do have sensory overload and do need certain structures. So even going to things like a family picnic or a family reunion, things that we do constantly year round in
Mm-hmm.
African American communities, you might have to not go and have to
Mm-hmm.
set that boundary and say, you know, my child who has autism, they're not able to be at, you know, this family function because it's too many people and too many people are going to be asked too many questions and that's going to be too much for them.
Yeah.
Is that something that you often tell parents too, that in a community where we're always having family gatherings, we're always having some type of community gathering, how to navigate that when you're setting up boundaries for your child who is living with autism, and some of those activities might be too much for them.
Mm-hmm. Exactly. I what I tell parents and what I do for myself is I go based off of my child. So
Mm-hmm.
I know what, you know, to a certain extent she can handle. You know, she will let me know.
Right.
So, you know, she doesn't mind family gatherings. The noise may be too much for her. She will put on a set of headphones.
Mm.
For instance, we went to Disney last week.
Mm-hmm.
She was fine at Animal Kingdom, Epcot, and Hollywood Studios. Magic Kingdom, she was not. There's a
Yeah.
lot more people. So we left. So what I'm doing is noticing how my child is reacting to the situation. And you have to do the same thing with your family gatherings. You know,
Right.
my family makes accommodations for my child because they love her and they want her there. So
Right.
they make those accommodations.
Right.
But even in the sense, if that's too much, then, you know, I'm going to remove my child and, you know, that's just that.
Right.
You know, I what else can I do?
Right.
So,
Right.
so I'm just going to remove her. But I think you just have to know your child and watch for those, you know, signs that they've had enough. Listen to them when they say, okay, this is enough. Watch out for the sensory overload because it is a lot. There's a lot coming at them. Sounds, taste, smells,
Yeah.
lights.
Right.
Lights are a big thing, you know.
Right.
So you have to just prepare yourself, prepare your child. You know, you can prep your child as well to let them know, because changes, sudden changes for children who are autistic can cause, you know, a lot of
Right.
issues.
Right.
So
Right.
you have to prep them, let them know this is where we're going, this is what we're going to do, things like that. So they have an idea of where they're going, you
Right.
know.
Right. And I really appreciate what you're saying, because I think, and again, this is something that is changing in our African American culture, you know, the idea that the child is to be seen and not heard. But I think there are still some older people, there are some other generations where this idea, this notion of listening to your child, really getting into their headspace and making decisions, not based on what your child wants, but based on what they're needing in that moment.
Mm-hmm.
And maybe even sometimes depending on the situation, what they
Mm-hmm.
want. I
Yeah.
think that's something that can be a really huge mind shift in the
Mm-hmm.
African American community when it comes to parenting and child raising. Is that
Yeah.
something that you've noticed as well?
It is, and that's just across the board, even for neurotypical. You know, my parents wanted me to do certain things and not say certain things, and I had difficulty with it. I wanted to be heard. So for
Yes.
me as a parent, if even if my child wasn't on the spectrum, I wanted to do something different
Yes.
with her. But knowing that she is on the spectrum just makes me listen a little bit harder,
Yes.
because one, communication is different,
Yes.
with a person who is autistic. So you have to be more patient,
Right.
listen a little more, things like that. And, I advocate for my child now because she can't do it for herself.
Right. Right.
But when she can do it for herself and we're teaching her how to self-advocate, you better believe I'm going to listen to her and what she wants, because I don't speak for her in all
Yeah.
situations. She speaks for herself because she is her own person.
Right.
And I think that is something that in the African American Black community, we really have to let go of. We need to be able to listen to our children and know what their needs and wants are. Sometimes they aren't going to align with what your needs and wants are as a parent. And sometimes you do have to make that difficult decision of, okay, what I am doing is what I think is best for you, because I'm still your parent.
Right.
Because children still, they're not aware of everything that goes on in the world.
Right.
So we still do have to make the best decisions, but listen to them, hear them out, let them know that they have a voice and you're going to listen to it, and they're not just something like, okay, whatever. No, listen to what your child is saying.
Right. I love everything that you're sharing. And I think it is a cultural shift to understand how not just autism kind of manifests itself in our children or in our families, but I think also this idea of how mental health looks in the community, and what does it look like to have services and to have therapy, and for that not to be so stigmatized and shameful. So I really appreciate what you're sharing there.
Most definitely. I just want to make a change in our communities, to know that, one, autism isn't bad,
Yes.
and other, because autism is a developmental disorder, but mental health is not bad either.
Yes. Yes. Yes.
Just because you have a therapist, you're not crazy.
Yes. Yes.
I hate that we use terms so loosely, bipolar or crazy, things like that. It just kind of diminishes what is really going on with mental health,
Right.
what is really going on with autism.
Yeah.
I really wish we would take accountability more for the words that we say.
I agree. I agree. You're not wrong at all. And I think it takes people like yourself who start communities and start the discussion to really bring that to the forefront. Because I think, again, we can all say, oh, I'll make a change. But it's one thing to say that, it's another thing to know how to do that. So I think you're one of those voices that's like, this is how we're going to start doing it. These are the communities and the discussion groups that we're going to start having, so we can change that language. We can change that rhetoric that we're so used to.
Yes. Thank you for that. I do. I just want to, let parents know that there is no shame in having a autistic child.
Yes.
There's
Yes.
nothing wrong with your child. They don't need to be fixed. There is no cure for autism, but we don't need to be searching for a cure. That alone, like you have to see how the actions of what you're doing can be impactful to your child. So if I'm constantly trying to find a cure or looking to change who they are, then they're thinking something is wrong with them.
Yes.
And I don't ever want my child to think that something is wrong with her.
Right, exactly.
Sorry, I'm very passionate.
No, and I love that you got into that. And, I feel like it's one of these topics that we could definitely talk about all day. And I love the passion and the expertise that you've brought with us already. And so what I want to do right now is give you a space to let our audience know how they can connect with you, how they can learn more about the resources you have and the groups that you have.
Okay. I am on Facebook. I'm on Instagram. I'm on Twitter. On Facebook, I'm at Autism in BLK. On Twitter and Instagram, it's Autism in Black. My website is www.autisminblack.org. And also, I have a little special something for everybody listening. If you type in autisminblack.org/checklist, you get a parent checklist of basically how to go through the steps of, if you're suspecting, to getting the diagnosis, to who you can go to then the types of therapies that you can check out.
Yeah.
So again, it's autisminblack.org/checklist. And then you can have that, because I know it's overwhelming. Mm-hmm. So I gave you a nice little guide to try to help you with that.
I love it. And so don't fret if you were listening and you didn't jot any of those resources down. All of those links will be in the show notes that accompany this episode. So if you're looking for more resources and more ways to connect with other African-American parents who are parenting a child on the spectrum, I think it's a great space to start with Maria's resources and then move on from there. Maria, thank you so much for being on with us today, sharing your passion, sharing your expertise, and giving our audience a little bit more information about this topic.
Thank you for having me. Glad to have been here and shared everything.
See ya.
Bye.